Avocado and Arthritis, Natural Nutritional Relief for Seniors. Imagine waking up one morning and feeling something different. Your joints, which have been stiff and painful for years, somehow feel easier to move. What if I told you that something as simple as adding a specific fruit to your diet could make a significant difference in how your joints feel? I'm not talking about expensive supplements or prescription medications with long lists of side effects. I'm Dr. David Walker, a senior health and psychological wellness expert with over 30 years of experience helping older adults not just add years to their lives, but add life to their years. Today, I'm going to share with you how this humble green fruit, avocado, has been scientifically proven to help reduce arthritis symptoms in ways you might never have imagined. Before we dismiss this as just another health fad, let me show you what decades of research and my clinical experience have revealed about the remarkable connection between avocados and joint pain relief. Avocados' anti-inflammatory power. Have you ever wondered why some people seem to age with less pain than others? What's their secret? The answer might be simpler than you think. While genetics certainly play a role, what we put on our plates every day has a profound impact on how our bodies age, especially when it comes to inflammation, the driving force behind arthritis pain. Inflammation is your body's natural response to injury or infection. It's supposed to be temporary, helping you heal. But when inflammation becomes chronic, it starts damaging your joints instead of protecting them. This is what happens in arthritis, whether it's osteoarthritis from years of wear and tear, or rheumatoid arthritis from an overactive immune system. Let me tell you about Margaret, a 72-year-old patient of mine who came to me barely able to open a jar of pickles because her hand pain was so severe. "I used to love gardening," she told me during our first appointment. "But now I can barely hold my trowel for 5 minutes before the pain forces me to stop." Margaret had tried various over-the-counter medications, but the side effects on her stomach made them unsustainable for long-term use. I suggested she add half an avocado to her daily diet, along with some other dietary changes. When she returned 3 months later, she brought me a small potted herb garden she had planted herself. "It's not perfect," she smiled, "but I can garden again. That's all that matters to me." But what exactly makes avocado so special for arthritis sufferers? Let's break down the science. First, avocados are rich in monounsaturated fats, the healthy kind that your body needs. Unlike saturated fats that can increase inflammation, monounsaturated fats actually help reduce it. One study found that patients who consumed foods rich in these healthy fats showed decreased levels of C-reactive protein and interleukin-6-2 proteins in your body that indicate inflammation. Even more impressive is that avocados contain something most other fruits don't: vitamin E. This powerful antioxidant specifically targets the inflammation pathways that affect your joints. And when these pathways are calmed down, you feel less pain and stiffness. Studies show that diets high in these compounds are linked to decreased risk of the joint damage seen in early osteoarthritis. But there's something else even more fascinating about avocados that most people don't know about. Scientists have discovered a compound derived from avocados and soybeans called unsaponifiables. These compounds have been studied extensively and have shown remarkable results in reducing arthritis pain. In fact, clinical trials have found that avocado-soybean unsaponifiables, ASU, can actually modify the progression of osteoarthritis, not just mask the symptoms. They do this by inhibiting certain enzymes that break down cartilage and by stimulating the repair of cartilage tissue. Multiple scientific studies have demonstrated that ASU can reduce the need for pain medication in patients with hip and knee osteoarthritis. Now, before you start thinking this sounds too good to be true, let me be clear. Avocados are not a miracle cure. You won't eat one avocado and suddenly be able to run a marathon. Arthritis management requires a comprehensive approach, including appropriate exercise, weight management, and sometimes medication. Always consult your doctor before making significant changes to your diet, especially if you have existing medical conditions or are taking medications that might interact with certain foods. But I've seen time and time again how incorporating avocados into a balanced diet has helped my patients regain mobility and reduce their reliance on pain medications, which often come with unwanted side effects, particularly for seniors. Here's something to consider. What if you could reduce your need for NSAIDs like ibuprofen even by 25%? That could mean significantly less risk of stomach bleeding, kidney problems, and heart issues that often accompany long-term use of these medications. And that's exactly what some studies on avocado compounds have shown is possible. I often ask my patients, what would you do if you had less pain? The answers are always touching: playing with grandchildren, gardening, dancing, traveling. These simple joys of life shouldn't be sacrificed to arthritis if there are natural ways to help manage the condition. Let me share another quick story before we move on to the next section, where I'll explain exactly how to incorporate avocados into your diet for maximum benefit. William, an 80-year-old veteran with severe knee osteoarthritis, was skeptical when I suggested dietary changes. "Doc, I've tried everything," he said. "I'm scheduled for knee replacement in 6 months because nothing else works." I convinced him to try avocado consumption along with other anti-inflammatory foods while waiting for his surgery. 3 months later, he called my office. "I'm not canceling the surgery yet," he said cautiously. "But for the first time in years, I climbed the stairs without holding the railing with both hands." My wife couldn't believe it. So what exactly is happening in your body when you eat avocados regularly? And how can you make sure you're getting the most benefit? That's what we'll explore next. How avocados work in your body. Have you ever wondered what happens inside your body when you eat an avocado? The journey from your plate to your joints is fascinating and explains why this fruit can be such a powerful ally against arthritis pain. When you consume avocado, you're not just eating a delicious food, you're delivering a precise combination of nutrients that work together to address inflammation at its source. Let's take a closer look at this process. First, avocados deliver a powerful trio of inflammation fighters: monounsaturated fats, antioxidants, and phytochemicals. The monounsaturated fats help repair the cell membranes throughout your body, including those in your joint tissues. When these membranes are healthy, they're better able to block inflammatory substances from entering the joints. But what makes avocados truly special is how they affect your body at the cellular level. The fruit contains compounds that actually inhibit the production of cytokinase molecules that signal your body to increase inflammation. By reducing these signals, avocados help break the cycle of inflammation that causes joint pain and stiffness. Robert, a 68-year-old former construction worker who came to me with severe hand arthritis, explained it best after adding avocados to his diet for several months. "It's like someone finally turned down the volume on my pain. It's still there sometimes, but it's not screaming at me all day long anymore." Now, you might be wondering, how much avocado do I need to eat to see results? That's a great question. Research suggests that consistency is more important than quantity. Studies show that consuming just half an avocado daily can provide meaningful anti-inflammatory benefits. The key is making it a regular part of your routine, not just an occasional addition. Here's something crucial to understand about managing arthritis with diet. It's not a quick fix, but rather a cumulative effect. The benefits build over time as the anti-inflammatory compounds accumulate in your system and gradually modulate your body's inflammatory response. Did you know that the humble avocado contains more potassium than a banana? This mineral plays an essential role in nerve function and muscle contractions, both critical for joint movement. By ensuring proper electrolyte balance, the potassium in avocados helps maintain smooth joint function and may reduce cramping around arthritic joints. Another little-known fact about avocados is that they contain natural substances called saponins, which have shown specific benefits for knee and hip osteoarthritis. These compounds appear to influence the structure of cartilage cells, potentially slowing down deterioration and even supporting repair processes. What surprises many of my patients is learning that the most powerful anti-inflammatory components might actually be in the part of the avocado we typically throw away the seed. Recent research from Penn State University found that avocado seed extract exhibited strong anti-inflammatory properties in laboratory studies. While we don't typically eat the seeds, this research underscores just how potent this fruit is as an anti-inflammatory food. I often hear from skeptical patients, if avocados are so beneficial, why hasn't my doctor mentioned them? The truth is, conventional medical training often focuses on pharmaceutical interventions rather than nutritional approaches. While medications certainly have their place, nutritional strategies often get overlooked despite growing scientific evidence. For maximum benefit, try to choose avocados that are fully ripened. Studies suggest that the anti-inflammatory compounds become more bioavailable as the fruit ripens. A perfectly ripe avocado should yield slightly to gentle pressure, but not feel mushy. Let's pause for a moment and consider how this information might change your everyday life. If you're currently taking medications for arthritis pain, I'm not suggesting you stop. Always consult with your doctor before making such decisions. But what if adding avocados to your diet could help you reduce your dosage over time? What if you could have more good days than bad? Think about the activities you've given up or reduced because of joint pain. Maybe it's playing with grandchildren, gardening, dancing, or simply walking without discomfort. What would regaining even part of that mobility mean to your quality of life? In the next section, I'll share practical, delicious ways to incorporate avocados into your diet even if you've never been a fan of their taste or texture. Plus, I'll reveal the optimal ways to prepare avocados to maximize their anti-inflammatory properties. Because it's not just about eating avocados, it's about eating them in the right way at the right time. Practical ways to include avocados. But Dr. Walker, I don't really like avocados. I hear this more often than you might think. The good news is that there are countless ways to include this nutritional powerhouse in your diet even if you're not a fan of the taste or texture. The key to making avocados work for arthritis relief isn't just eating them, but knowing how to prepare and combine them for maximum anti-inflammatory effect. Let me share some practical strategies that have worked for my patients. First, let's talk about ripeness. An unripe avocado not only tastes poor, but also contains fewer bioavailable nutrients. How can you tell if an avocado is perfectly ripe? Remove the small stem at the top. If it comes away easily and you see green underneath, it's ready to eat. If it's brown underneath, it's overripe. If the stem doesn't come off easily, it needs more time to ripen. Helen, a 75-year-old patient with rheumatoid arthritis, told me she tried avocados before and just couldn't stand them. I suggested she try mixing mashed avocado with a bit of lime juice and salt into her scrambled eggs. It disappears into the eggs, she reported back. But I still get all the benefits, and my morning stiffness has decreased noticeably after just a few weeks. Here are some of my patients' favorite ways to incorporate avocados, even if they're not avocado enthusiasts. 1. Morning Smoothie Boost. Add 1/4 of a ripe avocado to your morning smoothie. The mild flavor disappears behind fruits like berries or banana, but you get all the anti-inflammatory benefits. The healthy fats also help your body absorb other nutrients better. 2. Avocado chocolate pudding. Blend a ripe avocado with a tablespoon of cocoa powder, a splash of milk or dairy alternative, and a touch of honey or maple syrup. The chocolate completely masks the avocado flavor while preserving all its benefits. 3. Creamy salad dressing. Puree avocado with a bit of olive oil, lemon juice, and herbs to make a creamy salad dressing that delivers a double dose of anti-inflammatory fats. 4. Avocado tea. This might sound unusual, but avocado leaf tea has been used traditionally in South American cultures for arthritis relief. You can find avocado leaf tea at specialty stores or online. 5. Baked egg in avocado. Remove the pit from half an avocado and crack an egg into the hollow. Bake at 425 degrees Fahrenheit for 15 to 20 minutes. The egg adds protein while the heat doesn't diminish the avocado's anti-inflammatory properties. Remember, consistency is key. Research indicates that regular consumption provides better results than occasional large amounts. Aim for about half an avocado daily, or at least 3 to 4 times per week, to maintain a steady level of those beneficial compounds in your system. Some of my patients express concern about avocados' calorie content. It's true that avocados are relatively high in calories, but these are nutrient-dense calories that actually support weight management by promoting satiety. In fact, studies show that people who regularly consume avocados tend to have lower body weight and less abdominal fat, important factors in managing arthritis pain, as excess weight puts more stress on your joints. Here's something important to consider: timing. Some research suggests that consuming avocados earlier in the day may maximize their anti-inflammatory benefits. Many of my patients report less morning stiffness when they include avocado with their breakfast rather than later meals. For those concerned about the environmental impact of avocados, consider sourcing locally when possible or look for sustainably grown options. The benefits for your health are substantial, and there are increasingly sustainable avocado farming practices available. Let me share a practical tip from Frank, an 82-year-old patient who found an ingenious solution to the overripe avocado problem. I freeze ripe avocado chunks on a tray, then store them in a bag in the freezer. They're perfect for smoothies, and I never waste any anymore. For those taking blood thinners like warfarin, talk to your doctor before significantly increasing avocado consumption. While generally safe, avocados contain vitamin K, which can affect blood clotting. This doesn't mean you can't enjoy avocados, it simply means your medication may need adjustment. Let me address another common question. How long will it take to see results? Based on both research and my clinical experience, most people begin noticing subtle improvements in flexibility and reduced pain within 2 to 3 weeks of regular avocado consumption. More significant benefits typically appear after 1 to 2 months of consistent intake. I believe in being completely transparent with you. Avocados alone won't eliminate severe arthritis symptoms. They work best as part of a comprehensive anti-inflammatory diet that includes other beneficial foods like fatty fish rich in omega-3s, colorful fruits and vegetables, nuts, seeds, and olive oil. Consider avocados your entry point to a broader approach to managing inflammation through nutrition. If you're serious about using nutrition to address arthritis pain, what you eat with avocados matters too. Try to pair them with other anti-inflammatory foods for synergistic effects. For example, avocado toast on whole grain bread with a sprinkle of turmeric provides multiple inflammation-fighting compounds that work together. In our final section, I'll share the latest research on avocado compounds being developed into concentrated supplements specifically for arthritis relief, plus a simple weekly meal plan that maximizes avocado's benefits while keeping your diet varied and delicious. I'll also address which types of arthritis respond best to avocado therapy, because while beneficial for most forms, the effects can vary depending on your specific condition. Throughout my 3 decades of practice, I've witnessed countless patients reclaim activities they thought were lost to them forever. Like Dorothy, a 79-year-old grandmother who had given up knitting, her lifelong passion, because her finger joints had become too painful and stiff. After incorporating avocados and other anti-inflammatory foods into her diet for just 2 months, she called me, her voice brimming with emotion. "Dr. Walker, I just finished a baby blanket for my new great-granddaughter. My hands still get tired, but the pain doesn't stop me anymore. I feel like I've gotten a piece of myself back." These are the moments that remind me why natural approaches to health matter so much. It's not just about reducing inflammation or improving clinical markers, it's about restoring dignity, independence, and joy. It's about being able to hug your grandchildren without wincing, tend your garden, or dance at a family wedding. The journey to managing arthritis is rarely a straight line. There will be good days and challenging days. But adding avocados to your anti-inflammatory toolkit gives you another powerful, natural option known with virtually no side effects other than improved heart health, better digestion, and often weight management benefits as well. I believe deeply that aging doesn't have to mean accepting pain as inevitable. With the right knowledge and tools, you can take meaningful steps toward greater comfort and mobility, regardless of your age or how long you've been living with arthritis. Remember that while avocados have impressive research behind them, they work best as part of a comprehensive approach to health. Always consult your doctor before making significant changes to your diet, especially if you have existing medical conditions or are taking medications that might interact with certain foods. The path to feeling better might be simpler than you think. It might start with something as humble as adding half an avocado to your daily routine. Small changes, consistently applied, often lead to the most sustainable improvements in health and quality of life. I'd like to leave you with a question that I ask all my patients. What would you do if you had less pain tomorrow? Whatever your answer, hold on to that vision. Let it motivate you to take that first step toward better joint health today. If you found this information helpful, please don't keep it to yourself. Share it with someone you care about who's also navigating life after 60. The simplest acts of sharing knowledge can profoundly impact someone else's quality of life. I invite you to subscribe to this channel for more evidence-based health information specifically designed for older adults. Hit that like button if you found value in today's content, and don't forget to click the notification bell so you never miss our new videos on healthy aging. In the comments below, I'd love to hear your experiences with avocados or other foods that have helped your joint health. Your stories not only inspire me but can provide valuable insights for others on similar journeys. Remember, my goal isn't just helping you add years to your life, but adding life to your years. Until next time, this is Dr. David Walker wishing you comfort, mobility, and joy in every day ahead.